Hey, this is Dr. Gardner. I wanted to talk briefly about a couple of topics. One is, why do vein doctors and lymphedema specialists, why do they work together, or why should they work together? I will just tell you from my perspective, having lymphatic referrals is huge for my practice, because obviously one of the main things that a vein doctor is going to deal with is swelling. I used to try to do this alone, where I would try to, put people in Uniboots and then try to work them and do the compression. I refer a lot of patients to lymphedema therapists because I want that volume reduced. Let me give you a good example. If I get a patient, say they've had knee replacements, they have big swollen legs, and really from the knee down, it's like a tube. There's just so much swelling at the ankle. That is not a patient that I want to treat from a vein standpoint until that swelling has been addressed. So if I can refer them and have that lymphedema therapist basically get the volume out, decrease that the size of the leg, one, they're going to heal faster, and two, their risk of infection and post-op complications goes way down. So it's a huge win-win for me. The other thing is, long-term, I know that this patient is going to need to be in some sort of compression, either a Velcro or a class 2 or a class 3 compression. That's not something that I particularly want to manage. And so that's where my lymphedema therapist really is an asset to my practice, because these patients are everywhere. And if you think you can go it alone as a vein doctor and not be affiliated with a lymphedema therapist or compression specialist, then I think you're kind of missing the mark and you're not providing the best care for your patients, because there are a lot of my patients that commingle between vein and lymphatic issues. So yeah, from my standpoint, it's a huge win-win, and I highly recommend, if you're in a vein practice, if you're a vein doctor and you're trying to go it alone, you need to partner with a lymphedema specialist, because they're going to be able to add quality to your practice, something that you're not going to be able to do on your own. So yes, we are partners. You need to find somebody that's a good referral source. And I get referrals to rule out venous disease in patients with chronic swelling. Guess what? A lot of times those patients have underlying undiagnosed venous disease, right? Phlebolymphodema. It is a real thing. Undiagnosed, untreated venous disease long-term can lead to lymphedema. So again, these things exist together. I think that, or I would say, I would recommend to anybody in a vein practice, if you don't have a relationship with a lymphedema therapist, you need to make that, because you're going to be amazed at how it's going to really improve the quality of care that you can provide to your patients that specifically have swelling issues, even after you've taken care of their venous problems. The other thing that we have to think about is, if you're a lymphedema therapist and you're going it alone without a relationship with a vascular doctor, then again, you're missing the mark. You're probably under-treating your patients, because I will guarantee you there are a large number of your patients that have undiagnosed, untreated venous insufficiency, that if you will take care of that aspect of it, you're going to drastically reduce the amount of swelling that they have. Not in every case, but in a lot of cases. You're actually going to make your job a lot easier, and you're going to help your patients, because they're going to be so much more compliant, because it's less swelling that they have to deal with every day. I can't tell you how many times I've seen somebody come in with a big swollen tree trunk leg, looks just like a lymphedema leg, but it's really a phlebolymphodema leg. And again, if you're a therapist, a lymphedema therapist, trying to go it alone, trying to wrap and pumps and all these other things, you're really going to do yourself a service if you will go seek out and partner with a vein specialist. Again, somebody that dedicates their time to the diagnosis and treatment of venous insufficiency. I think it goes both ways, and really we need to be partners. So anyway, we can work together. It's a great opportunity to provide better care to the patient, and that is the overall goal. So thanks.